Hi everyone, my name's Aiden and you're listening to the very first episode of your Stomach Friendly podcast. On the show, I'll be talking about various digestive diseases. So I'll be looking at, again, what's sort of causing these diseases. Is there a genetic link? Is it an environmental trigger that's sort of bringing about these symptoms? Again, what sort of is the cause? I'll be talking about different food sensitivities. So probably the most common ones, right, are gluten intolerance and lactose intolerance. Right, those are probably the two big ones most people have heard of. But again, there's so many others. So I'm going to again be discussing those the top two, but of course looking at all the different ones that exist. And then finally, I'll be talking about some stomach-friendly alternatives for people, again, who have these food sensitivities, right? So what other options exist to still, give you those nutrients that you might not be getting because of your food intolerances. At the same time, I'm going to try and bring on some guests on the show. So these will include gastroenterologists. So again, that's a fancy word for just doctors who specialize in the gastrointestinal field. I'll be talking to dietitians, nutritionists, even physical trainers. Again, to get sort of a holistic view at our digestive health and what we can do to again improve symptoms if we suffer from one of these digestive diseases. And then finally, I'll be talking to, again, people who have a digestive disease or disorder, right? And again, sort of we'll learn from their personal experience. Again, if you have a digestive disease and you want to, again, come on the show and sort of help others who might be in a similar boat, or if you just have suggestions of topics you want me to talk about, feel free to leave a comment, or you could contact me at stomachfriendlypodcast@gmail.com, and I could get back to you there. And so now I want to, again, before we get into the actual content for today's video, I want to mention a little bit about my background. So again, I'm not a doctor, right? I did do my undergrad studies in biochemistry, so I do have an understanding there, about the digestive system, about how these diseases could work. And then now I'm actually doing my PhD in biomedical engineering. And during my PhD, I actually created a digestive health app called GastroTrack AI, where, again, I was inspired by, I saw so many people suffering with digestive diseases, symptoms, right? And I didn't think there was a good enough way to track your digestive health out there, right? So again, I came up with this app. It's still under development, but the key things that it's going to be able to do is it's going to be able to, again, track your digestive symptoms, but it's also going to track, your diet, your exercise, stress levels, right? And we're going to try and make the correlation between, again, those factors I mentioned and your symptoms, right? So we want to try and figure out what could maybe be exacerbating your symptoms, and we're doing this all with AI, right? So again, app is not public yet. I'll try and give you all just some updates if you're curious as we go along this journey here. And again, if you want to learn more information, you could always go to the website www.gastrotrackai.com. And again, you'll get the latest info through there. All right, now we're getting to the actual content. So again, today I wanted to go through some of the most common digestive diseases. And yeah, so again, I'm going to do my best to go over all of these. I might miss some, right? These are just sort of the ones that I found through my research. But again, if you want to, if I leave one out and you want me to cover it, again, leave a comment and I'll follow up with those in another video. So the first one that I'd like to go over is, again, I'm sort of starting top to bottom for your digestive, the digestive tract, right? So we'll be looking at the esophagus, right? And so the first disease that affects the esophagus is gastroesophageal reflux disorder, or disease, sorry. So again, it's a mouthful, and so people call it GERD by short. And so that's what I'll do in this video. But so again, essentially GERD is, chronic acid reflux, right? So the stomach acid, again, acid in your stomach, it's constantly kind of coming up through your stomach and into your esophagus. And this is caused by, again, a weakening in a certain muscle called the sphincter, right at the bottom of your esophagus leading into the stomach. So it's the sphincter's job to, again, stop the acid from going up. But again, as this muscle gets weakened with age, right, maybe there's some other damage there that could be caused. But essentially that weakening of the muscle, again, is causing the acid to come up. And so this is leading to heartburn, food regurgitation, a bunch of these sort of really annoying symptoms. So again, this disease is not rare, right? Mentioned it's actually 20% of people suffer from GERD. So again, that's a huge segment of the population, right, that have this chronic acid reflux. And again, so I mentioned it's more likely with age. There's like some genetic link there in some cases. So again, if a member of your family has GERD, you are more at risk, right? So just to sort of keep an eye on it. And again, if GERD gets really bad, or again, you've had it for a long time, it could lead to something called Barrett's esophagus. And so Barrett's esophagus, it sort of involves a change in the cell lining of, again, the esophagus due to this constant acid coming up. And so that could actually be precancerous. So again, it's important if you have GERD, or you suspect you might have GERD, to get it diagnosed right away. And the big things, though, however, are going to be just mainly changes to your diet, right? You're going to want to avoid acidic foods, or you're going to avoid coffee, maybe carbonated drinks, right? That could also lead to some of that acid coming up. So yeah, it's really going to be mainly lifestyle changes. But again, it's important you recognize early on if you have this condition. And now one that's actually very similar symptoms, but again, caused by something different. It's called a hiatal hernia. And so a hiatal hernia, how this one works is actually a little bit, I find it a little strange, but actually you have your diaphragm, right, right above your stomach, right? And your esophagus, to get to your stomach, has to go through your diaphragm. So there's actually a small hole in the diaphragm to allow the esophagus, to connect to your stomach and then the rest of your digestive tract. But what can happen is, again, sometimes now it's the weakening of the diaphragm muscle. Your stomach can actually sort of start to move upwards. So it sort of bulges through the diaphragm, right? And now this is causing more pressure, And again, it's leading to that acid reflux, right? Acid from your stomach moving up. Now it's more pressure, and again, leading to those symptoms I was mentioning. Heartburn and of food regurgitation are the two biggest ones. And again, that one's really common as well. I believe I saw somewhere it's about 10%. Of course, these numbers vary, country to country, right? Ethnicity has a big role in many of these diseases. Your sex, your biological sex, and again, your age. So again, I've taken a look now at ones that again involve this acid reflux. Let's take a look at one that it's more based on, again, your stomach. So the first one that I'll talk about are symptoms that affect your stomach. So this one is gastritis, right? So whenever you hear itis at the end of words, right, whether that's like gingivitis, arthritis, right? These are all, this just means inflammation, right? And so again, in the case of gastritis, sort of gave it away, right? Gastro is stomach. So, you have stomach inflammation, and this can be caused by a number of different things, right? But one that's the most common would actually be a bacterial infection of one that's I've heard of the most often cited is H. pylori. And so H. pylori is a unique bacteria because it can actually reduce or make the stomach acid less acidic, okay? And so how it does this is there's, again, urea and in your stomach, and the bacteria H. pylori is going to, through an enzyme called urease, it's going to sort of degrade urea and turn it into something called ammonia, right? It's a common byproduct of many biological reactions, right? All that to say is ammonia can actually change the pH of your stomach, right? So again, making it from very acidic, right, where nothing's really going to live, into something that's, where more bacteria can actually sort of grow and proliferate, right? So again, as soon as, some H. pylori gets in there, right, due to maybe another change in the, stomach conditions, right? Something that can sort of be an indicator, or again, sort of a cause of this H. pylori infection, is something called hypochlorhydria. So that one I find hard a little bit to say, but what happens here is, again, the hydrochloric acid, right? That's your stomach acid. It's mainly hydrochloric. This acid is going to, there's going to be less of it, right? And again, that could happen through age. As you get older, you just produce less of the stomach acid, right? So when your stomach is slightly less acidic, just ever so slightly, now this H. pylori can come in, right? And it could start, some of it can sort of survive in that harsh environment. And now it's able to, again, change the acidity even more so that more H. pylori can come in, and, now you have a big problem. And again, this is going to cause
inflammation, right? Damage to your stomach lining, right? And can even eventually lead to peptic ulcers, right? So where you're going to have sort of even a break in the stomach lining, right? And it'll sort of bulge out. And again, that could be very painful, right? So again, you're talking, stomach pain. If there's bleeding, right, it could, you could have bleeding in your stool. And yeah, so again, a number of nasty symptoms, and that many of us wish we do not have to deal with. Perfect. And now this one's also a little interesting. We have something called functional dyspepsia. Now, why I say this one's interesting, or especially compared to the first three diseases I talked about, is it's actually not even a disease, right? It's sort of how we call a bunch of symptoms, right? And we actually don't even know what's causing these symptoms to arise. So that's sort of why you can't call it a disease, because a disease you need to know what's causing it, right? But in this case, doctors don't, right? We're not there yet in our research, and so yeah, people just you go through a bunch of tests, right? Let's say, okay, you don't have chronic gastritis, okay, you don't have again, none of these ulcers, none of these stomach ulcers or a cancer. Hey, let's just, you know what? You have functional dyspepsia, right? And so it's kind of, maybe with time, as, our diagnostic ability improves, right? Maybe some of these functional dyspepsia cases, we're going to realize it's maybe another disease. Maybe we're going to find out again that what's causing it to begin with. But again, we're not quite there yet. And again, you'll present very similar symptoms to gastritis, for example. Again, you're just not going to see that inflammation that's associated with gastritis. One fun story, though, with functional dyspepsia is that Pepsi, again, the soda company, right? They actually got their name sort of from this whole process, like from functional dyspepsia, right? And how I say that is because back in when Pepsi was first coming up with their soft drinks, it was sort of marketed as a drink that can improve or relieve indigestion, right? So they called it Pepsi after one of these enzymes in your stomach, pepsin, right? And that's how they were trying to market it at first. Of course, now it's shifted. There's actually not much evidence at all, right, that Pepsi can actually improve digestive symptoms for people with different diseases, but it's how it came about, which I find very, very interesting. All right, so next one we have here, it's called small intestinal bacterial overgrowth. So again, you'll find most of these digestive diseases I'm going to talk about, right, it's very long names, right? So they always shorten it to, again, acronyms. So again, I'll refer to this one as SIBO from now on. And so SIBO, there's, again, many different symptoms that you'll get because of this bacterial overgrowth. Right, so one to look at, right, is because of these bacteria in your small intestine, where again there's normally not that many, just because it's right after your stomach, and so it's still pretty acidic, not many, and fast flowing, so not many bacteria are normally able to culture there. But again, that H. pylori is one of the big ones that can. And so H. pylori, again, if you get an overgrowth of that one, or again, even an overgrowth of different bacteria there, You can get many different symptoms, right? So, for example, bloating, right? When these bacteria, right, as they're sort of working, right, they're going to be producing gas, which again is going to give you that bloating sensation. There can be some malabsorption issues, again, when SIBO gets more serious. So because these bacteria, again, are not making it easy for your body to absorb nutrients, right? They're using many of these nutrients, right? And so even, I believe, B12 is, again, one of the nutrients that, normally we're absorbing in the small intestine, right? Many different nutrients, right? Calcium, etc. But so the B12, right? We need that for energy. That's a big one for energy. And these bacteria are actually using it themselves, right? So now it's not being absorbed by us. And so again, you might feel tired, more tired than normal. Just general fatigue, chronic fatigue. And so again, it's, if you have these symptoms, it's really important, again, you go see a doctor, or, you're researching yourself. And again, just really take these digestive symptoms seriously, because again, if you don't address it early on, it could actually lead to, again, more serious issues down the line. All right, and the next one, probably one of the most common or most talked about, I find, digestive diseases out there, and it's called irritable bowel syndrome, or again, IBS for short. So again, I find, many people have this disease. I think it's about, again, 15%. It really varies, though, the numbers, again, country to country. But again, I'll say roughly, especially like for the Western population, it's around 10 to 15%. And again, this one's exactly like the functional dyspepsia that I mentioned, in the fact that, there's no real cause to it that we've identified, right? So obviously you're presenting with all these different symptoms, but again, there's not something that we're able to pinpoint that, this is this is what's causing you to have, like, and how can we treat it, right? So just like dyspepsia, and again, many of these other diseases, it really comes down to, you're going to have to be making lifestyle changes, right? Change your diet. Again, foods to avoid, I believe, for people with IBS, right? Sometimes it's gluten, dairy, but it could also be tomato, garlic, many different sort of symptoms that you never think of. There's something I'll talk about a bit later called, a low food map diet. And so again, some people with IBS, they find that helps if you go on this low food map diet. But yeah, so there's many things you're going to have to start to avoid, start to think about, right, if you get diagnosed with IBS or, again, these other diseases. Okay, and now, again, I was trying to go sort of in order from, again, esophagus all the way through your digestive system down to your rectum, anus, etc. But there's also these sort of side auxiliary organs, right, that aren't sort of directly connected one after another, right? And so there's actually three of them. We have the liver, the gallbladder, and your pancreas, right? And so again, there's a specific word for it, but again, I'm sort of calling them auxiliary because, again, food's never traveling through these organs, but they play like a very big role in digestion, and proper your digestive health. So again, I'll take a bit of time to talk about I'll start with the liver. And so the first disease that affects the liver is hepatitis, right? So again, hepatitis actually just means, again, inflammation of the liver. And again, due to that itis suffix at the end there. But again, hepatitis can be caused by a number of different things. So the ones that first come to mind for me are, hepatitis A virus, hepatitis, B virus, C virus, right? At least for me, right? I had to get those shots in school. So I'm very familiar with this is just a mandatory shot you have to take. I was less familiar with, again, exactly the meaning behind it, why I needed it. But again, so this virus can actually cause inflammation of the liver. And the liver is actually, I believe it's the largest internal organ. It's like the second most complex to the brain. So anything that sort of adversely affects the liver can have big consequences. So anyways, for hepatitis A virus, it's actually not too bad. Right, I say that, maybe you're going through it, maybe you disagree with me. But this one, right, it's more of sometimes you don't even present with symptoms. And it'll go away, right? That's the big one, right? It's never really going to be a chronic condition, right? It'll be one thing that's sort of unique about all of these viral infections that, again, impact the liver is that they have a really long incubation time where, again, you could have no symptoms, again, at all, right? So I believe it's something like a few months in general for a lot of these liver, viruses, which is crazy, right? Like imagine for COVID, right? Like what I think the incubation time, they said it was something like, 7 days on average. Imagine if it was like 2 months, right? Where you're presenting zero symptoms, right? And then during this whole time, you could be passing it on to different people, right? Again, the hepatitis A virus does not work like that. Fortunately, it's nowhere near as infectious as, again, COVID. The only way you could actually pass on, again, hepatitis, the virus to different people, right? It's generally, it could be through a fecal, transmission or blood. Blood's also very common, and again is the main one for hepatitis B and C. And yeah, so those are again, I'm sort of talking a lot about these different viruses, but again, it can be, I think it's very important. And again, for hepatitis C, it's actually can become chronic. Right, so unlike A and B, it's much more likely to become a chronic condition, and unfortunately, that's the one that you actually you can't get a vaccine for because there's just so many different mutations of this virus. You can't even get a vaccine. So, it's sort of it's unfortunate. It's like that, right? That's biology for you, but. All right. Yeah. So again, I talked a lot about hepatitis. Another one that affects the liver is, again, fatty liver disease. So you could have alcoholic-induced fatty liver disease or non-alcoholic, right? So again, the non-alcohol-based one actually affects something like 33% of the population. So it has, a huge impact on society, right? The alcohol-induced also, right, is pretty common. But again, that one, at least, it's very simple, right? You could stop drinking alcohol, and generally,
you'll sort of revert back to the norm. Something similar can be said for, again, the non-alcoholic fatty liver disease, where, again, if you change your diet, again, you make those necessary changes, you can sort of reverse a lot of the damage. The key problem here, though, would be if, again, you don't make any lifestyle changes, and sometimes, right, you don't even present with any symptoms, again, with these fatty liver diseases. So, again, if you don't know how you're going to make the changes to your diet, again, generally it's spotted soon enough that, again, you could totally reverse many of the symptoms, and, again, damage to the liver. It's just when, again, for example, if you start getting symptoms for the alcohol-induced fatty liver disease, but you keep drinking alcohol, right? There's something like 50% of, I might get this number wrong, but something like 50% of people who do this end up dying after 5 years. So again, it's something, you have to take control of yourself. You have to make an action plan and follow it through, right? But it's totally possible, again, in most cases. But again, if you keep going through that, or you keep eating fatty foods, highly processed foods for the non-alcohol induced one, right? You don't make any changes to your diet, then you're going to start getting scar tissue to your liver that can be irreversible. And again, I'll talk more about that actually in my next video. But again, so it's just really, I'm trying to get across the point, really important to recognize there's a problem right away, and start to correct that, again, through your diet and through other lifestyle changes. All right, and then now, again, I've talked about the liver, the other auxiliary organ there that, again, helps with your digestion is the gallbladder. Okay, and so first off, this organ, right, the liver produces something called bile, right, which is going to be used for the small intestine and again help with digestion, right? And so the gallbladder is sort of just like an intermediate storage place for all this bile. So again, the bile comes from the liver, goes to the gallbladder. Sometimes it'll concentrate the bile, right, to make it more effective at, again, degrading fats that, again, pass through the small intestine. And again, so it sort of works with the small intestine, the gallbladder. But a disease that, a common disease, this one I believe I have here, affects 10% of adults, is when there is a gallstone that forms, again, in your gallbladder, right? Or not even in your gallbladder, actually in the bile ducts. So you could sort of think of this as, again, I mentioned your gallbladder, your liver, and your pancreas, and your small intestine, actually, right? There's a network of sort of these ducts that connect them all, right? You could think of it as a highway, right? Somewhere in a big city, right? You're going to have multiple overlapping roads, right, going to different places. And so if one of these gallstones blocks the road, for example, from, again, your gallbladder to your small intestine, then again, there you have a problem, right? So again, that only happens when the gallstone is big enough, right? You could have small gallstones that
that form. And again, you wouldn't even know it, right? It's just not big enough to block these bile ducts. But again, when it is big enough, right, you can get a bunch of different symptoms. Some ones that are sort of different from other digestive diseases are something called jaundice or jaundice. I think of it as jaundice because, again, I speak some French, and jaune actually means yellow. All right, and jaundice, or again, jaundice, I'm mixing it up now. But what this symptom is actually, again, the yellowing of your skin, or even the whites of your eyes. And again, what brings about this is because in your bile, there's something called bilirubin. And bilirubin, again, it's sort of this yellowish brown pigment, right? And if the bile can't get to the small intestine, right, it's going to sort of go back into your blood, into your bloodstream, right? So again, now instead of, again, exiting properly through your digestive system, you're seeing it again at your skin, again, in your back of your eyes, which, again, I feel would be terrifying, right, if you've ever experienced this. But so again, that's one key difference. I have, again, just checking my notes here quickly. But another thing with these gallstones, right, is that you can also start to get itchy skin. So again, when the bilirubin, right, when it gets back into your bloodstream, right, it could start to irritate those vessels near your skin. So again, yeah, it's going to be itchy. So again, those are sort of the two main different symptoms I find from most digestive diseases. And of course, you're going to get, the pain, right, in your abdomen, right? But again, since the organs are all so tight together in your, again, abdominal region, it's really hard to differentiate. Oh, is that, again, am I feeling gallbladder pain right now? Or, is that my stomach? And last thing I wanted to mention actually on gallstones is they're more common actually in women, right? And this is because estrogen, right, can actually increase the level of cholesterol in your blood. And again, cholesterol, that's also found in your bile, right? And if there's too much cholesterol, that's going to, again, cause the hardening of the bile and forming many of these gallstones. So again, women are also, females are more at risk. Okay, so I'm almost through my list here. We have the next one I wanted to talk about is called Diverticulitis. And so this one actually isn't as common as many of the other ones I talked about. But diverticulosis is very common. Again, I'll get to the difference between those and, again, how they're connected. But so again, in diverticulosis, you're going to have these small pouches or sacs that are going to form in your large intestine. And again, when these pouches form, they're called diverticula, right? Sometimes they can get inflamed. So when they're, again, inflamed, that's the diverticulitis. When they're not inflamed, that's the diverticulosis. So again, when you're, I believe, over the age of 50, 30% of people have diverticulosis. So again, they have these pouches, but it's just not causing any inflammation yet. And actually, over the age of 70, I think it's now 70% of people have these have these pouches or, sac type formations in their colon. Right, and again, when they're inflamed, right, that could cause a lot of pain in your abdomen region. Right, it could lead to bleeding in your stool in some cases, and again, fatigue. I believe loss of appetite is also a symptom there for people with diverticulitis, but I'd have to double check that. But yeah, so again, not fun. Again, none of these are fun, but yeah. So lastly, we're almost done there, right? So we've gone esophagus, stomach, small intestine, large intestine, and then again, now we're sort of finishing up. We're going rectum, anus, right? So one that is, again, very common, especially when you get older in age, is called hemorrhoids, right? So this is when there's a blood vessel that, again, gets irritated, inflamed, and again, it's right by, again, your opening there of the anus. And so, again, whenever you pass a bowel movement, right, this could be really, really, really painful, and again, can result in bleeding in the stool, and again, yeah, just very intense pain down in that region. And again, one thing to note, just for general knowledge, right, is when there's bleeding from, again, a condition like, what did I mention here? Like, again, diverticulitis, there's bleeding, sometimes gastritis, right, when there's an ulcer, or peptic ulcer, right, when that forms, that could lead to bleeding. The higher up in the gastrointestinal tract, the bleeding is going to come out as sort of black, right? So versus, which I'm sure we're more accustomed to when it's hemorrhoids, right? It might be like bright red, right, for your blood. So again, the reason, right, it's as it's passed through your digestive system, right, it's being processed differently, right, and now it's no longer presenting that bright red color. But again, it still indicates bleeding, right? And it's still a big problem. So just look out for that. If you ever notice, black stool, that's also can be a very concerning sign. Could also be a sign of certain medications, though, to be fair. So again, you just have to be really conscious of all these different components that can affect your digestive system. And yeah, so again, I've sort of gone through, those are my most common digestive diseases. Next episode, I think I'm going to try and go over the most severe digestive diseases, according to me, of course. And but again, after that, if you have a suggestion for an episode, if you're, again, really curious about one specific disease, or whatever it is, let me know, again, in the comments, and again, I'll try and talk about that in another episode. So again, thank you so much for listening, and yeah, there we go. That's the show. Have a good day, everyone. Take care.